Education and Sports, Dr. Dennis Mujimba, with us. Doctor, you're most welcome to our studios this morning.
Thank you so much, Robert, for inviting us. Good morning, and good morning, our viewers.
Reopening, the word you've been using.
Yes.
And His Excellency also said we need to open, but must be safe reopening. Looking at day 1, day 2, and maybe day 3, let's just have a brief analysis.
Yes.
Was this reopening or was it safe reopening?
I think to put it in a more contextual way, this is reopening like no other. We are reopening, but in a safe manner. Our end game as a sector is to ensure that education institutions of learning are COVID-safe places. As much as possible, would like any teacher who is there, that is professors, lecturers, etc., if you're there, feel safe that you'll not contract COVID from there. Number 2, when our learners come, would like them to feel safe in that institution. So are the academic staff. So is any visitor that is coming to that institution. We want them to feel safe. So the end game is COVID-safe institutions of learning. We have a series of strategies for achieving our end game. One of them, the leading one, is vaccination, because it works. Robert, these places you see where people are reopening their economies, they are not doing so because COVID has disappeared from them. No. They are doing so because a significant proportion of their populations are vaccinated. Take an example like the UK. They have a huge caseload now of COVID, but they are the cases which do not necessarily require a lot of admissions. So though they have so many cases, but the admissions are still low and deaths are low. Now, some of these things you really pray that God have mercy on us. We do not have such scenarios here because we do not have yet the significant proportion vaccinated to stem such a tide. Now, when we talk of safe reopening, we must ensure that whoever gets in is vaccinated. Now, these tertiary institutions know, because they lost teachers, they lost lecturers, they lost professors. Now, not only that, the age bracket of most of these category employees in these institutions are in the vulnerable age group, 50 and above. If you lose a professor, it's going to take you years to replace that person. You can fill the position, but you'll not get the experience. So we've been hearing from the academic staff themselves are saying they are not going to let in staff or learners who are not vaccinated. And this is consistent with what we've been saying from the start. We've been blowing the trumpet telling learners who are 18 years and above in tertiary institutions, before reopening, go get vaccinated. And we started as early as 16th September, when His Excellency gave that light that we are going to reopen first November, 11th hour. Same thing as vaccination. We've been saying, go and get vaccinated. The vaccines are there, but people do not want to listen. And now you've probably been hearing some students being sent away at the institutions of learning that were opening on Monday. Now, some people try to extend, to push the limits to see how far can I get to the cliff without falling off. And the institutions are saying, no, you're not going to enter.
And regarding that, what is the ministry's position? Because, you know, Uganda, everything, we go into the laws, we go into rights. When universities, when tertiary institutions decide, for example, I'll take Chambo where I witnessed it, you're reporting, they're checking you, but your vaccination card has to be with you. So to what extent does the ministry welcome this, and how much can it hold if being conducted, if it's made a policy by most of these institutions?
Because we are in unusual circumstances, we are dealing with a highly risky event. Our position has been consistent. You only report when you've been vaccinated. Both students, non-teaching staff, and teaching staff. That position has not changed. In case there is, because where to be vaccinated from is purely tactical decision. The strategy is vaccination. Whether you get vaccinated from home, from the institution, that is a tactical decision. A tactical decision can be modified. But as of now, the tactical decision is don't let students in who are not vaccinated, because you're going to get into a situation whereby those who are not vaccinated are more than those who are vaccinated. And when people are already in, they don't to enter the institution. Robert, you will indirectly be undoing your strategy, because everyone will be like, okay, now we know head teacher when we reopen for the basic levels, you will be responsible for enforcing the SOPs, and one of them is vaccination. You have to ensure that only those who are vaccinated show up. If they are not vaccinated, let them stay out. Now, staying out, you can choose maybe to stay out and continue your online learning, but you will not be let in. Then the other SOPs that you're responsible for enforcing as a head of institution is ensuring that you bring in learners in a phased manner. And Robert, so far we are very pleased. We are not seeing crowding. The institutions have managed the lots that are coming in. So, because once you have crowding, by the crowding, and even if you're vaccinated, if you crowd a place, you will still transmit this virus. You will still have to enforce the wearing
congestion
of
is a fertile ground.
Congestion of any sort. And some countries are learning the hard way. They eased the lockdown, even after they had attained a certain vaccination of their population. They eased the lockdown. They put down the other SOPs of social distancing, wearing of masks, etc. And now they saw a surge. So they realized, hang on a minute, it is not, vaccination does not stop transmission. It just reduces the probability of you transmitting the virus. But it does not mean that when you transmit the virus, it is less virulent than, no, it is not. It doesn't mean that your virus, because your is weaker than someone who is not vaccinated. No. If it lands on someone who is not vaccinated, it will cause either mild disease or severe disease or hospitalization and even death. So these are the measures that our institutions need to be mindful of, that yes, people are vaccinated, but please do not let down your guard. You still have to observe other SOPs.
Doctor, how fast can we achieve this? We've had months of availability of vaccines.
Yes.
And I stand to be corrected, but the last I checked, I think those that had received their first jab, now teachers, were at 63%.
Okay.
Those that had received their second jab, I think, were at 32%. This to me seems still a lesser number.
You've really raised a concern. We are progressing, but we are not where we want to be. As of Monday, the 1st of November, we noticed that we had moved a little higher by 3 percentage points. We are now at 66%. Those are the ones who have received the first jab. We would like that proportion to move closer to 80% or so. Now, the reason is when you have that number who have received the first dose, you're sure that those people will likely also receive the second dose. Because I think we've not yet started using the Johnson & Johnson vaccine, which is just one shot. So when we see the first dose takers increasing, we get excited. Now, we are at 66%. The Minister of Health said once the learners have reported, they'll give us the tallies for the students who have been vaccinated and the teaching staff, because that parameter was not part of the initial data sets they were picking. So we have made some progress. It has reached a level where it's not moving as fast, and yet we know the vaccines are there. So where you're finding that Robert is coming from a sub-county where you know the health center 3 has the vaccines, but Robert is not getting vaccinated at that health center 3. He's waiting to come to the institution unvaccinated. Really, you see that student is not, it's not that he's trying to extend the boundaries to feel how close can I get to the institution or even enter without being vaccinated, because the vaccines are there. Now, the other measure that we had taken, we negotiated with the Minister of Health, and we identified education institutions as vaccination centers. We communicated this to all local governments. In KCCA, all the tertiary institutions were actually vaccination centers. The vaccination teams went there. To an extent, there are days when there was even zero turnout for vaccination.
Very true. I've gone to some in Machindi where these people are seated and they are waiting.
Exactly. The vaccination teams are there waiting. There's no one turning up. But then the students show up and they are not vaccinated and they want to enter the institution. Really, we have to be serious. Because you see, we need to understand that if we do not take this matter seriously, these three, because we have reopened for 1,450 institutions, tertiary institutions. They have about 310,000 learners. It's a small number. But I can tell you that 310 that we have released has the potential to disorganize the whole country. And this is how it can happen, Robert. They are going to hostels. The hostels can be crowded. So you're having crowded hostels with unvaccinated people who, when they are in the hostels, they are interacting with the communities. Remember, these students have not been in the hostels all the time. They've come from all over the country. So one of the things you're going to see is if we don't take the SOPs seriously, you'll begin seeing the community transmission rates within the communities around hostels or tertiary institutions go up. So one of the SOPs that was communicated to tertiary institutions, especially the higher education institutions, by National Council of Higher Education, is that the higher education institution has the responsibility of reaching out to the hostel owners and engaging them on minimum SOPs to ensure that when the learners go there, they do not create a chamber for propagation. A breeding center. Exactly, of COVID-19.
Doctor, away from the vaccination and that is the SOPs, I want us also to look at the period of study.
Yes,
this time, many parents, many students have pointed out that a semester of about 4 months, now it is going to be 1 month, and they're feeling maybe cheated in terms of tuition. As the ministry, to what extent, because universities have some bit of autonomy.
Yes.
But to what extent are you concerned regarding this issue?
Thank you, Robert. Now, what our listeners need to understand is that when His Excellency the President announced and announces, and hopefully he will not announce again, a lockdown and closure of institutions of learning, he's stopping congregating of learners, but he's not stopping learning. So learning can take place even outside the institution. So you have had universities, these tertiary institutions closed, but actually learning has been taking place. For some of them, they've been administering online learning. Now, why that one has to be done is that because we are dealing with a situation that is not the normal running of a semester, they have to come up with a compensation mechanism. And that compensation mechanism has to ensure that when Robert returns to the lecture room, you know that Robert is not going to be there for the normal semester of 15 weeks because you have other learners also have to come. So in order to recover the lost time, you are going to give Robert some time and then he goes back home so that you bring other learners in. Now, every learner is not going to get the same time. It is not equal time in class, but it will be equitable. Equitable meaning that there are some learners who will be given more in-person attendance time, more time at the university or tertiary institution than others because of the nature of courses they are doing. For example, those who are heavy on hands-on, let's say in the technical vocational institutions, in the sciences at the universities, because you do not have a laboratory or a workshop at home, you'll need more time in the workshop at the institution. Yes. Exactly. So you will find that some learners are having more time at the institution, whereas others are not. Now, the universities and tertiary institutions have the liberty to do that. Now, when you leave, it doesn't mean you've gone on holiday. Actually, learning continues because the institution is going to give you work or assignments that you have to continue engaging with. And you're going to send this information back to the university or institution for assessment by your lecturers. So learning is continuing, but what is in our mind is that a semester runs when I'm only in the university campus or institution campus. But the semester is going to be running even when I am out. And that one also comes to answer the issue of school fees and tuition, because people are saying, if I'm going to be at the institution for 4 weeks, 1 month, or 6 weeks, or whatever, why do I have to pay a certain amount of tuition fee? It's because even when you're not in the institution doing in-person attendance of lectures and lessons, you're still being supported by the institution. And the institution has overhead costs it has to keep on maintaining, paying for the bills, etc., to sustain supporting you even when you're at home.
Well, let me remind our viewers that you can be part of this topic of discussion this morning by simply going on our various social media platforms and sending your question, your concern regarding the issue we are discussing, which is the reopening of universities and tertiary institutions. The number to call is just on your screen. That is a 0709 60 25 92. That is 0709 60 25 92. Please send in your questions, and the mouthpiece of the Ministry of Education and Sports will be responding to them as they come in. Now, Doctor, when we talk about in-person learning and out-of-class learning, we know this requires the internet. And Uganda have made strides, but we are not yet there. I know there are certain parts of this country that when you're there, it's hard to access internet. Even where you can access it, it's quite... I have a campus at my place, but this person will tell you that per lecture, if he's to attend maybe 5,000, if he has about 3 hours a day, I have to part with that amount of money. So how are you factoring in this as the mother Ministry of Education in this country?
Now, you've raised a pertinent concern, which our minister, the First Lady, has always been telling people who are thinking about continuity of learning. She has been saying that even we technocrats, when we are designing our interventions for continuity of learning, we need to be mindful of the average Ugandan. Now, the average Ugandan and learner where they stay, it is not just access to the internet. You need, for you to access the internet, cannot afford these gadgets and the internet costs. Come from the same households where the basic education learners are coming from. So the issue of internet affordability is big. She's aware, and the ministry is really aware about this. There is something being planned that she's spearheading, and I don't want to preempt. I don't want to take her thunder. Let her be the one to announce, but she'll be announcing some strategic high-level engagements where she'll be engaging with the private sector to see how they can work with us to support the recovery of learning and continuity of learning. But one of the things that will perhaps be addressed is how can we make internet affordable for learners? It may not be for the whole country because that is out of our mandate, but at least for the learners. And how can that be arranged? Now, even when you look at the students who are telling me that when they go for the Zoom classes, now, depending on the Zoom license you have procured, there is a limit to how many learners or people can get on the call. Some is a limit of 100. If you have not paid for the license fee, they only limit you, I think, to about 40 people or 40 minutes. Now, there are some learners who have been saying that they get in onto the Zoom class through the internet, and then they cannot join because the slots are already full. So there is a lot, and this is where we were saying that don't be quick to condemn the issue of universities charging or tertiary institutions charging tuition fees, because buying a Zoom license requires money. And these are costs which universities and tertiary institutions have not been incurring most of the time. So these are some expenses that are unique to the secondary. The number one prescription as a solution for continuity of learning for both tertiary institutions and basic level of education. That is why in our strategies for continuity of learning as a ministry, we are saying there has to be a calendar for in-person attendance. So that online learning complements or supplements what in-person attendance has been able to attain. Yes.
Well, thank you, Doctor. Allow me now move to some of the questions that are coming in from our viewers. And I want to first of all thank you so much for being part of this show by contributing your questions. Really appreciate this feedback. Let me begin with good morning, moderator. Which criteria all methods are the tertiary and universities using to detect the forced vaccination cards, since the case is too much? This is Chinene from Agago. I think the fake, though you typed forced. I hope Chinene have gotten it right. Good morning. Thank you for the wonderful show. I am Sam Bureo watching from Munyonyo. My question is, for the secondary school sector, are the senior 5 students going to report in Form 6, or are they going to stay in senior 5? Because there are stories moving around that UNEB is in May. Thank you. I'm Hussein Santos. To me, it doesn't make sense to open the institutions. The government should have waited till January, whereby most students are vaccinated. It is just going to, still that is in line with education. Well, thank you all that are sending thanks, are appreciating the program. I'll just be reading out your names, but thank you for being part of the show. And of course, thank you so much for sending in those messages, showing your appreciation towards the program. Doctor, let's first handle this, yes. Then we shall.
Thank you so much. Now, the issue of authenticity of vaccination cards. It is, let me put it this way. First of all, it is even sad that we should be checking your card whether it is authentic or not, because this is an issue of your health first and foremost. So ideally, in an ideal situation, the responsibility or the burden of ensuring authenticity of the card should be on you, the student, because should you fake a card, you will not be able to fake immunity. Therefore, COVID will find you out. That is one. Number two, on the internet, there is a link that was generated by the Ministry of Health where you can actually certify whether the card being produced by Dr. Dennis is actually genuine or not. Because online, that is where you can get all the authentic information of who are the people that are actually truly vaccinated. Now, of course, these institutions are going to continuously check. You may sneak through because the card you have been able to fake is so good that it almost resembles the genuine one, but you'll not be able to fake your name on the system in the database. But again, I really appeal to Ugandans and our listeners. It is about your safety, that we should have that moral compass within us, that I am doing something out of my own good, but because of my love for the others. Love your neighbors as you love yourself. If you cannot love yourself enough to get vaccinated, then don't show up in the classroom.
Looking at question
then number two, will senior 5 reporters, senior 6 or not? We are going to release a calendar that is going to detail how we are going to manage the transitions or the progression of learners already in the system. So once the contributor of this question has raised an issue that we've always been saying. Not everyone, by the way, is calling for reopening of education institutions. Not everyone is doing so. There are those voices. So far things are going well. We are starting with a small number, 1,450 tertiary institutions, 310,000 learners, and all this is consistent with our strategies for reopening, because we consistently said we shall start small and go bigger. So within these 2 months, we shall have learned lessons on what we can do better even when we reopen for the basic education levels. Who are the entities that has been earmarked for takeover by government? Now, the processes of sorting out some of the administrative and management issues of the institution, those I'm not yet comfortable discussing those in public.
Well, okay, let's still look at those that have come in through SMS. Will all classes be opened in January, or it will be in phased approach? I didn't get your name, but thank you so much for that. Another, what of those below 18 years? Won't they be vaccinated? That is still also a question coming to you, Doctor. Then we need such updates. Carry on the talk show, please. And we need them countrywide. That's Joram. Thank you for being part of GMU this morning. Another question now. Thanks for the show. I'm Rubogo Benjamin Blessy, live from Kamuli. I would like to ask the doctor, in most places, teachers miss their date of vaccination. Up to now, what's the way forward? Yeah, then, okay. Thanks for the show. I think, please let doctor comment on this schedule, Sergeant Bernard. GMU, thanks for the show. Checking vaccination cards may be easy for public institutions. What is the way forward for private universities? I see a challenge. That is Sergeant Bernard. Thank you for being part of it. But there is a calendar. He has academic year for 2022. School term, when they start, when it ends. Maybe I'll send it to doctor and you look at this. That needs you to comment about. That is Sergeant Bernard. Ministry of Education develops 3-year calendar. Yes, and he got it from somewhere. Let's just go with that in the interest of time.
Okay, thank you. What about, let me begin with the one of, what about the learners who are less than 18 years old? Now, our focus has been on learners in tertiary institutions who are 18 years and above, but also learners who may be having comorbidities or pre-existing medical conditions. So far, the only vaccine we have in this country that is suitable for learners who are below 18 is Pfizer. Now, the current stand is that anyone who is 18 and above, go get the vaccines that are available at the center, vaccination post. Now, even when you come for the second jab, you should clearly state that, first of all, come with the certificate. If not, tell the person going to vaccinate you that in the first round, I got this kind of vaccine, because the Ministry of Health has guided clearly that they should not be mixing of vaccines in this country. Don't have AstraZeneca first dose and second dose Pfizer. Not in this country. Other countries may have taken that path, but not in this country. Now, we have not yet fully focused on learners who are below 18, because we have to first hit let's first get the 4.8 million priority groups who are above 18. That is the security forces, health workers, teachers, non-teaching staff, vulnerable groups who are 50 years and above, and persons with comorbidity.
Actually, the vulnerable groups are seeming to be doing bad.
They are doing very badly,
the last I checked, I think it was about 10%.
Yes.
Yet, they're the major culprits of these returnees from school.
Exactly. Now, that is where we want the public to help us mobilize. Let every learner, when you go back home, get your jaja, get your shwenkuru, get your elder person at home. Tell them to go and get vaccinated. We have not seen good movement in vaccination rates for the people who are 50 years and above. Now, you talked about when they wanted to. Let them go and find another appointment and get vaccinated. The door is not closed. Private universities, let us also say private education institutions, as Sergeant Bernard was asking. Everything we are talking about regarding implementation of SOPs and vaccination, they pertain to any education institution of learning. We are not only talking about private.
Well, Doctor, in the interest of time, let's end with those. Thank you for your contribution and, of course, your feedback. Let me have, in less than a minute, your final remarks to Ugandans regarding the reopening of tertiary and universities.
Thank you so much, Robert, and UPC for inviting us all the time. Now, regarding reopening, we call upon our parents, our learners, and our leaders and managers of the tertiary education institutions. Kindly work together to help us enforce the SOPs. We want to have COVID-safe institutions of learning, and we can do that starting first and foremost by vaccinating the right groups, and also ensuring that when we reopen, we do so in a phased manner to avoid crowding. We thank you.
Well, I thank you so much. Dr. Dennis Mujimba, that is the spokesperson of the Ministry of Education and Sports. It is upon you to get that jab, because what it does, it protects your life from severe illness and death. Please, let's go and embrace vaccination. We need to reopen in a safe manner. Let these institutions have people that cannot contract this disease and die, but also SOPs is not something we should give up in this fight against COVID-19. Have a lovely day. Ruben is here with so much in the world of sports. Till tomorrow, God be with you. Stay safe.
Wano wetutandikidde tutandise ne meeja ejjuddeko ebirungo ebya buli kati kakati njagala wekkaanyi kabaka yajja okuva ku sayidi omukimumbaasa akutte mu jjolo bano be bayita bakakujje wabula kyonna kyagenda okukola mukama yamanyi kagenda mu kaseera kano yajja bambi n'asooka akwata ebbakuli n'ateekamu buli kimu kyonna ky'omanyi ekiyitibwa ebirungo njagala wekkaanyi kakano bwebityo bibadde ebyolwaleero eruda nga bagamba ngenda kusaba olindirire ekijjulo makeke bakabulaza bonna mubayite ne kabaka n'asemberera okaggala mukama abankuumire.
Brought to you by GoTV Valley. For just 25,000 shillings, enjoy the world's biggest leagues and cap competitions. GoTV Uganda, love it. Getting GoTV was the best decision James has ever made. Finding a good place to watch football was never easy, but it was costly. Until James discovered something big. Now he can finally enjoy the benefits of home ground advantage with a decoder and 1 month of GoTV Valley for just 20